So I think our fellowship is unique in that we have all these multi-centric sites that the fellows get to get training in. We have great academics. We're always pushing them into scholarly activity. We have fantastic mentorship. We have the Hazelden Betty Ford experience on top of it. Overall, it's a well-rounded program, and our hope is that we can let the fellow have a good sense of themselves and be able to be advocates in the field of addiction medicine. We provide training in multiple clinic sites. We give them outpatient experience, inpatient, correctional medicine, methadone clinic, and then we also have the residential treatment at Betty Ford, and they get the trifecta. So they get the clinic setting where they get to treat patients, help them manage their daily lives while patient goes to work and still gives them the treatment and therapy. They do the inpatient setting where they see very complex patients, overdosing or very severe psychosis or withdrawal. And then at the correctional site, they get to understand what the prison culture is like and how to deal with patients who are inmates and how treatments need to be specified for them. They also get to go to the methadone clinic, which is a more tailored type of treatment. And they also have different electives where they get to do kind of what they want as well. And I think this just helps them to be a well-rounded physician, and our fellowship is unique because we provide all those different training sites. We definitely push our fellows to do scholarly activities, so if there are any interesting or rare case reports, we have them write it up. We want them to go present it at the national and state conferences. Every fellow does do a quality improvement project. We want them to find something like some kind of inequity or some issue in the hospital-based setting for them to improve. So every fellow gets to do that, and they also present that at the Eisenhower Research Day. We hope that by giving them that kind of academic training, they can be stewards and leaders in addiction medicine. So the fellows are constantly mentored. So with every clinical patient, every clinical encounter, we are constantly giving them advice. We go in with them. There are daily rounds. We provide them teachings on the neurobiology of addiction, the different treatments that are there. We also provide mentorship through case conferences, journal clubs. We do constantly monitor the fellow for burnout and fatigue and emotional distress. We have regular social events, dinners, get-togethers, so they don't just feel it's like a work or fellowship, but it's like a family. We all stay in touch. We stay in touch with the past fellows. They've been very successful as well. Everyone gets along. So I know that whoever chooses to do this fellowship, they're going to have a family for life. We train our fellows to not only treat the patient as a patient, but also as a person and provide patient-centric care. No matter where a person is from, no matter what their circumstances, no matter what their past is, we are going to treat them as an individual. Our goal is for them to have successful and happy lives just as any other person would have.